Hello, beautiful peoples. So, welcome everyone, and how are you? I hope you all are doing well. So, for today, I am going to discuss about epidemiology. So, today's main topic is epidemiology. We are learn about some basic facts and some questions regarding epidemiology, which was I learned in my previous video lecture, which was given by my instructor. So, let's get started the video. So before start the video, let me introduce myself. I am Astha Jaiswal and I am from section Wave 13E. Now at first, we are going to talking about what is epidemiology or the basic concept related to epidemiology. So what is epidemiology? Epidemiology is the study and analysis of the distribution, the patterns, and the determinants of health and disease conditions in a defined population. So whenever we're talking about epidemiology, it is the basic study or the analysis of the distribution or the patterns in a defined area. So whenever we're talking about a defined area or a confined area, it commonly or basically means that area with low peoples or the less people's rate. So we learn epidemiology in a confined area with a defined populations, and we learn about their and we learn and we study and we analysis the distribution and the patterns of health determinants. So whenever we're talking about the determinants of health, it is commonly or basically means the disease causing factors. So we learn about the disease causing factors in a confined area or a defined population, or in a confined area between or among a defined populations. So it is a cornerstone of a public health and shape policy decision and evidence-based practice by identifying risk factors for disease and targets for preventive health care. So we are learned about epidemiology for spread the information regarding epidemiology or the basic concept regarding epidemiology so that we can prevent the healthcare or we can prevent the spread of the disease. So we can diagnose the disease at a particular time and we start the treatment of the population so that the spreadness of disease may controlled by ourselves by spreading the knowledge regarding epidemiology or by spreading the knowledge regarding the health cause or of the disease causing factors. So let's get into the next slide. So the first question is, what is it important or why is it important to know the uses and the core function of epidemiology? So here are some factors which I'm going to share with you. So there are six major factors of the core function of epidemiology. So first one is health surveillance or public health surveillance. Second is field investigation. Third is analytical studies. Fourth is evaluation. Fifth is linkages. And sixth one is policy development. So we are going to discuss about those six factors or these six factors in brief details. So let's get into the next slide. So at first, we are going to discuss about public health surveillance. So public health surveillance. Public health surveillance is according to the World Health Organization. So we are gonna go with the WHO or the World Health Organization. The continuous systematic collection, analysis, and interpretation of health-related data needed for the planning, implementation, and evaluation of public health practice. So whenever we go with WHO definition, it is commonly or basically talking about the systematic collection of data. Like we have to collect the data in a defined population, analyze them, and detect the disease so that we can prevent the diseases in a confined time. And in this way, we gonna save as much as more peoples and save their lives. So next is field investigation. And in field investigation, we are going to learn about requires coordinated effort of dozens of people to characterize the extent of epidemic and identify its causes. So guys, as we all know that in field work, we have to move from one place to another place just to investigate the cases or just to know about the facts about the diseases, about the causes. So it needs some a large effort, or in the field work we need a dozen of people to characterize the extent of epidemic and to find the causes of the diseases. So in field investigation, like the field work is basically a hard work to detect the disease or to diagnose the disease and start the treatment among the population or among the peoples. So next we are going to learn about analytical studies. And in analytical studies, we are going to discuss about the purpose of an analytical studies in epidemiology is to identify and quantify the relationship between an exposure and a health outcome. The hallmark of such a study is the presence of at least two groups, one of which serves as a comparison group. So in analytical studies, we have to analyze the fact, like the in epidemiology, basically we are go through the identification or the quantify, like we have to deal with the quantities, and mainly we are deal with the relationship between an exposure and how health outcome. So the hallmark of such study is the present of at least two groups. So in analytical studies, mainly two groups. So the in analytical studies, basically presence of two groups are must, and in both these two groups, at least one group has to be served as a comparison group. So let's get into the next slide. Next is evaluation. And in evaluation, let's discuss about epidemiology, how evaluation is important in epidemiology. So epidemiology is the study of how often diseases occur in different group of people and why. So evaluation in epidemiology, like we are gonna go through like why diseases occurs in a confined area between a defined population. So we have to search about the main cause or about the main factor, like why disease caused among peoples, or the basic facts in evaluation term. Whenever we're talking about evaluation term, epidemiological information is used to plan and evaluate strategies to prevent illness and as a guide to the management of patient in whom disease has already developed. So in evaluation, we have to, like, we know that the disease is already spread among the people. So so our main focus is to stop the spreadness of the disease among people. So as we all know, like in evaluation, the disease has been already developed among the people. So the main focus is the prevention of the disease. The main focus is to that how can we control the disease, or the prevention factors, or the health control factors, or disease control factors. The main focus is to prevent the diseases from their causes or from health determinants. Like we gonna learn about much more about the health determinants, so that it is easy for us to control any diseases among the peoples. So let's get into the next slide. Next is linkage. And in linkage, basically in epidemiology, it is basically means that record linkage in the context of epidemiology refers to the putting together of information records on the same person, which may have been recorded on different occasions and became part of a different data collection. So record linkage, whenever we're talking about in epidemiology, basically it is means to putting, like we are gonna collect the information from the peoples or among the group of people, so that we can detect the disease, or we go to the depth, we go to the depth of the disease, so that we can know a much factors about the disease, and we can control or we can cure it easily. So next is policy development. And in policy development, we are going to learn about in the policy making stage, the epidemiological knowledge of the mechanisms involved in the development of health problems and the effectiveness or efficiency of intervention tools in combination with information obtained from other sciences in the field of public health and other fields can help as policymakers. So in policy making stage, basically, we are gonna take help about we are gonna taking help of some another policy makers also, so that we can connect a large group of peoples for the prevention of the diseases. So as we are connected with the most peoples of the society or the most helping societies, so it is easy for us to prevent or to cure the disease. So next is here is our next question, that is, what have you learned in the topic? So for me, epidemiological methods are used for disease surveillance to identify which hazards are most important. So guys, it is very important to know that which type of disease is hazardous for us, or which type of disease is of low intensity, so that we can handle it with easily. And some such diseases are maybe as hazardous for our health, so it may be life taking diseases, so lifelong diseases also. So it is very essential for us to know the fact that which disease is of high intensity and which disease is of low intensity, so that we can tackle the diseases about knowing their cells or about knowing the facts. So epidemiological studies are also used to identify risk factors which may represent critical control points in the food production system. So let's get into the next slide. Here are some epidemiological studies factors, or there are some basics of the epidemiological studies. So first we are deal with patients, and there is some disease and molecules, and in epidemiological studies we are going to learn also some alternative therapies also. So aims of epidemiology: first aim is to describe natural history of disease. Second, describe distribution and relative importance. Third, major frequency. Fourth, to define risk groups. Then to evaluate interventions, then to describe trends, to predict future trends and changes in disease presentation. So here is our third question. What are your realizations after watching the video lecture? So after watching the video lecture, the first thing which strikes into my mind is uses of epidemiology first. So first is assessing community health. Second is making individual decision. Third one is completing clinical picture. And fourth is searching for cause. So now it's time to enlarge these topics or to make a brief discussion on such topics. So at first, we are going to learn about assessing community health. So in assessing community health, a community health assessment, also known as community health, which needs assessment, refers to a state, a tribal, or a local, or a territorial health assessment that identifies key health needs and issues through systematic, comprehensive data collection and analysis. So guys, in community health assessment, it is also known as community health, which needs, like everything from which we are dealt from, it is always needs some precautions, or it may need some preventive cures or health measures also. So in such type of assessing community health, we can assess their state about their tribal location or their localities or their territorial health assessment to identifying their key health needs, like what the peoples need in their difficult times, so that we could help them easily, and about the systematic comprehensive data collection and analysis. So we can go there to meet the peoples as much as we can, so that we can collect the data, and we can collect the, or we can analysis the main causes of the diseases. So the next is making individual decision. So in this, we are going to learn about epidemiology is the method of choice for quantifying and interpreting health phenomena, which placing them into perspective to allow trend analysis and projections. It is a tool for analysis, evaluation, and forecasting, and thus it is indispensable and in decision-making process. So epidemiology is the method of choice. Like in epidemiology, we are going to quantifying and interpreting health phenomena. We are majorly talking about the interpreting health phenomena, as we are going to deal with the mainly health determinants among people, so that we can cure the diseases, and we can provide the health preventives, we can provide the treatments for the diseases. Our main aim or our main motive is the health prevention, is the disease prevention, is to stop the spreadness of disease among peoples. And next slide, the topic is completing clinical picture. In this, when investigating a disease outbreak, epidemiologists rely on healthcare providers and laboratorians to establish the proper diagnosis of individual patient. So in investigating a disease, it may lead to some main things, like epidemiologists rely on healthcare providers, like we need some healthcare providers such as laboratorians for the establishment of a proper diagnosis of the disease, so that we can cure the disease or we can prevent the disease. So, but epidemiologists also contribute to physicians. So epidemiologists also contribute with the physicians or to the physicians, so that they can understand the clinical picture and natural history of the diseases. Next, searching for cause. This is a last factor, I guess. So in this, we are going to learn about searching for the cause of a disease. It defines a cause, like in this or in the last slide, like searching for a cause of disease in this type of disease, in this topic, like we can find the cause of a disease, like we are trying to detect the cause of disease so that we can cure it. So it defines a cause as a factor without which an effect, adverse or favorable, would not have been happened. Like whenever we are suffering from any disease, it is not compulsory or it is not necessary that the disease is favorable. I just need to say that, like not not diseases are not favorable, but some people are think that some of the diseases are low intensity, so that we can tackle with them easily, or some diseases are high intensity, like we cannot tackle with them easily, like we need physicians for such type of diseases, for the health prevention or for the treatment of diseases. So no, diseases are not favorable. So we whenever we are sick, we have to go to the physicians for our proper treatment, so that the physician diagnose the disease at a particular time, so that your treatment has been started as soon as possible. So thank you, friends, for watching my slides patiently. Thank you a lot. Thanks a lot. Thank you so much. This is the end for our presentation. Thank you.